Thanks for joining us on the hypothyroid. Someone just sent us an email. Are we going to be talking about hypothyroidism? Absolutely. Low thyroid, all about thyroid. That's the message today. Previous teachings that we've done dealt with energy in general. And I talked about how low B12 status and how a very poor diet and too many carbs and not enough protein and how all these factors and thyroid and adrenal fatigue all played in. This today zeroes on low thyroid functioning and a lot of the misconceptions today about thyroid functioning. So we're going to talk about what's termed subclinical versus clinical. So clinical would just mean you go to the physician, they do blood work, they say that you have overt thyroid disease and we need to get you on thyroid hormone replacement. We'll talk about the details of that. But where I think a lot of us are stuck today is in this subclinical zone, that there are issues with major overt symptoms, whether it's hair, skin, nails, and lethargy and weight gain. This is just a smattering, by the way. There's a ton of, I could fill up this whole board with some of the symptomatology of poor thyroid functioning. But we want to zero in on is this subclinical aspects and how many patients are not being treated by their physicians well, or I shall say effectively, because of the focus just on laboratory values as opposed to matching overt symptoms, physical, clinical symptoms versus the laboratory settings. So hypothyroidism, low thyroid function, and then we're going to very much then slip into some of the causes for this, some of the interferences, iodine, understanding the role of iodine, why there's iodophobia out there, literally a phobia, phobic concepts regarding iodine status and the use of iodine. So we want to deal with that and dismiss some of that errant thinking and then put it kind of together. How specific nutrients. And you've got to understand that even if you're on hormone replacement, that's going to affect your thyroid function. Even if you're on bioidentical hormone replacement and you're doing it orally, that's going to affect because of thyroid binding globulins. You're doing synthetic or animal-based, it will affect your thyroid hormones, thyroid binding globulins. You're under a lot of stress, it decreases conversion of raw thyroid hormone T4 to T3. We're going to cover all of that. Don't forget, we've got a lot of other live streams, we've got blogs, we've got some written teaching blogs, we've got some of the old versions of these. We've stepped up our game. Josiah has stepped up his game. No. If you haven't noticed, so we're trying to do it a little more professionally as opposed to me just sitting here in front of a camera. So hopefully you're enjoying this. Go back and look at the old ones. And as I said, maybe we didn't have the structure or function externally that was very professional, but I still think the message is worth you taking a look at and going back and viewing. Hey, let me read to you. You know, I always like to do this. And I talked today on the show, and I've talked this past week about hope and how we lack hope and how hope ultimately comes, our hope has to be focused on God, not on man. Psalms 33 talks about it. I forget which it was. I believe it was Psalms 33. I have it bookmarked right here. That you can't trust in essence, horses. You can't trust in the size of your horse and the strength of your horse. You can't trust in the size of your army. In other words, we can't trust on our contacts and who we know and how much money we have and what our influence is and what our educational status is. Is that ultimately the Bible teaches us that the wise man trusts and puts their hope in Him. And then I believe God orders your life and can order your circumstances and make your relationships and give you the key things. But what do we put our weight down onto? Do we put it down on this physical? Do we put it down on my contacts, my knowledge, my horses, the size of my army? In those days, that's what we related to and equated to. Today, it's your influence. It's who you know. It's how much money you have. It's who you work with and who they know, right? The Bible's driving us back all the time to making sure that we lay our hope upon Him. And I talked about in the New Testament, in the Gospel of John, how Jesus said in essence that you can know God, you think. The Pharisees knew God, but they didn't know Christ. Therefore, they negated everything that they attempted to do in a religious manner because they denied the existence of Christ. Why? Because he claimed, in essence, being the Son of God, equality with God, and they said that was blasphemous. But ultimately, let's just go right to Proverbs. And it says, human plans, or to humans belong the plans of the heart. So I can have my thoughts and my ideas about what I want to do on this show and about what I want to bring to you on the air, or what little teaching. But as I pray this morning, as I even come to the show, or even when I'm here during the week, God, give me a word. Give me the words that I should speak. And I believe God does not fail us when we enter with that attitude. So I can have the plans of my heart, and I can have the plans of what I want to do. But ultimately it says, but from the Lord comes the proper answer of the tongue. All a person's ways seem pure to them, but the motives are weighed of the Lord. Commit to the Lord whatever you do, he will establish your plans. So I can have a plan. I can have the plans in my heart. Eventually what I speak, what I do, should be motivated by God. That's where ultimately the correct answers and the right and proper answers the Bible teaches us comes from. And even though in my mind things that I present to you or you present to others may seem to be pure and right, the Bible says that ultimately those motives are weighed by him. We're not fooling anybody, by the way. Commit whatever you do to him, and he'll establish your plans. I hope that encourages you. Let's roll to low thyroid functioning. Big problem today. It's huge. We're all over the board. Before I get there, I want to read to you an article. Now, this is bizarre to me. In the Journal of Clinical Endocrinology back in 2006, and it says, nothing seems to be more straightforward than treatment of hypothyroidism. We have, this is the medical community now, we have robust ways to diagnose the condition, even effective more than the way of replacement with synthetic thyroxine. However, the field appears to be in turmoil. Clinical endocrinologists are under increasing pressure from disaffected, in other words, disenchanted patients who believe their symptoms indicate hypothyroidism despite normal thyroid function tests. Does that sound familiar to you? A group of patients have lodged a petition in the UK, by the way, to the members of Parliament, to the UK General Medical Council, as a formal complaint, now watch this, against the clinical practice of the majority of medical professionals with regard to the diagnosis and management of hypothyroidism. And here's the 4 counts they bring. Over-reliance on blood tests and a total lack of reliance on signs and symptoms. Total lack of reliance on signs and symptoms. History of the patient and clinical appraisal. In other words, they're saying, which I believe is true, most medical practitioners say, what's your labs? Here's your blood work. You're fine. You're not fine. I'll put you on meds, and never really talk to you about the level of depression, weight gain that you can't deal with, the dryness of your skin, the brittleness of your hair and the falling out of your hair, the thinning of your outer aspect of your eyebrows, looking at your nails and the thinness and the brittleness, and there could be other issues with that, poor diet, poor absorption, etc. But remember, just talking about thyroid today, don't want to complicate this. Complications with skin, fatigue, constipation, lethargy, intolerance to heat and cold. I could go on. I mean, honestly, I could just fill up this board, but let's go back to the point. Over-reliance on blood tests, total lack of signs and symptoms, and history of the patient. Now, mind you, this was brought by lay people, literally, if you will, to the government in the UK 7 years ago, saying, we've had it, we're suffering, and all these physicians do in the world of endocrinology is want to analyze a lab, and I will say a value, a piece of paper, and not me. So what did physicians do before these labs? What did they do? Seriously, what did they do? Reflex, Achilles tendon reflex, knee reflexes, basal body temperatures, how's your skin, how's your hair, how's your nails, are you tired, are you fatigued, are you constipated, let me look at your skin, are you puffy and bloaty, do you have puffiness around your eyes, Do you have legitimate weight gain that you're telling me the truth, that you exercise and you've changed your diet and you're not eating all that junk and you still gain weight? Are you mood disorder, depression? That's what physicians of old did. So these folks went to the UK government and said, we're tired of it. Emotional abuse, watch this, blatant disregard for the majority of general practitioners and endocrinologists and suffering experienced by untreated or incorrectly treated thyroid patients, lack of compassion over the fate of their patients, stubbornness of endocrinologists and general practitioners to treat patients suffering from low thyroid medication with level of medication that would return them to optimal health, an ongoing reluctance to encourage debate on further research, hallelujah, on hypothyroidism. This is like golden to me. This is, I even forgot I had this. I just found it, praise God. Seriously, 5 minutes ago, right before we started this. I forgot I had it. I'm just looking through my files on hypothyroidism, you know, last minute, trying to get some thoughts together for you, and I'm like, whoa, I forgot I had this. I talked about this back in 2007, 2006 on the radio. So this summarizes where we are with this whole scenario. You say, Joe, get to the point. I got to make that point because you might be listening to this and be struggling. I think I'm crazy. My physician says there's nothing wrong with me. I believe there's something wrong with me. I don't believe my thyroid's functioning well. I am dieting. I have cleaned up my diet. I'm not eating late at night. Why am I so tired? Why am I so fatigued? Why am I constipated? Why am I so cold? Why are my feet so cold? Folks in the UK said, we want to storm Parliament because this is almost, literally, it's negligence. It's almost abuse. And just a couple other thoughts. Subtle thyroid problems triple the risk of placental separation in birth. Study finds. I mean, this is not just about, oh, well, I want to feel better. It may be safe for patients taking thyroid replacement to have lower thyroid stimulating levels than currently recommended. Current research shows. What are they talking about? That maybe for years, that maybe we've just missed the boat from how we're doing the analysis on thyroid. So hopefully that begins to give you a little bit of a flavor of what we want to talk about here today. So, male, female, let's get right down to it. Male, female. It is much higher in a female population, 8-to-2 ratio, female to male. It's believed that up to 25% of Americans right now battle some level of clinical or subclinical, the ones that are flying beneath the radar. You've been told your labs are perfectly normal, yet you have all these symptoms. You don't feel well. You don't feel right. So this portion, I want to, and if you have some questions, is it still the same for them to send questions to the same way? If you just go right to support, right on our site. Yeah, I mean, I'm going to entertain questions. I'm certainly up for this.
They can chat right in the box, too.
Right in that box, right on the on live stream. I should just give you a mic. That's Josiah, if you hear that voice in the background.
They can't hear me.
Yes, they can. All right, so I'm going to rewrite this. I don't know why I'm going to rewrite this, but okay, let's just talk about this. First of all, what could be going on here? A lack of pituitary. Your pituitary gland, literally, is what gives the stimulation. Your pituitary gland literally dictates how your hormones are produced, ovaries, testes in men, to your thyroid hormone, etc. So lack of pituitary function. So that has to be ruled out because in many cases that can be an issue. There's a way to look at that. You could have a low TSH, thyroid stimulating hormone, and also low thyroid hormone production, which would probably mean there's a pituitary problem. But that's for your endocrinologist, a medical practitioner, to quote, diagnose. I want to clarify for you today where they may be missing it, educate you. Maybe we can help you. Set up a consultation time. Call the off-air toll-free number. Let us coach you through some of this, put you on the right track, because it's not always just about more thyroid hormone or just desiccated thyroid or whatever. So number one, I could have a pituitary that's not telling me what to do. I could have defective synthesis. What's that mean? I'm just not making it well in my thyroid gland. Why? How would I not be making it well? Lack of adequate levels of tyrosine, an amino acid. I'll give you the details of that later. inadequate levels of minerals that help to make the conversion process go. I could just be not having enough iodine. Remember, we are iodophobic. We're iodine phobic in this country right now. We're paranoid about iodine. Literally, there have been articles written. One was by a Dr. Amster years ago, literally trying to portray and document how iodine was actually almost like a toxic compound, and that you shouldn't consume more than like 150 mics a day, and if you did, it gave you goiters. And the reality of it is, Japanese population consume probably 30 times the amount of iodine that the average American does. 30 times. Some literature shows more than that. Up to 50 times what an American does on a daily basis. And do you know that their rate of breast cancers are lower? There are other reasons, I believe, too. A lot of vegetables in their diet. But their high iodine status. Iodine is important to breast health in women. They have lower rates of fibrocystic breast disease. Thirdly, they have lower rates of thyroid dysfunction. I think a lot of it has to do with their iodine status. Why? Because poor iodine status, number one, if I don't consume enough because of the phobia that exists about how evil iodine is, and then I can have interferences that negate. I don't want to get in. I don't want to show you this. I was going to draw you how this works. I don't want to do that. And Josiah's crowd. I told him I'm learning to write better. Now that I'm looking at this, I don't think so. I don't think so. I got to make it. I have to, defective synthesis. I might not be making it. What could interfere with this? Well, not enough iodine, obviously, number one. Number two, I could have too much bromine coming from brominated breads. Number whatever. I could be exposed to too much chlorine, chlorinated waters, and so on. So there's a reason for this. Because if you looked at the valence chart, the chemistry, see, these guys are all kind of in the same category. Literally, I believe within the same two categories. So what you have is you have interferences with these other, we call them halogens. These are halogenated compounds. So these other halogens can interfere with iodine. Bromine and brominated bread. Most breads are brominated. Chlorine is a big issue. And now I'm forgetting what the other ones are. Just bear with me for a moment. Perchlorate. Perchlorate. Perchlorate is found in when you have clothes dry cleaned. Perchlorate. Perchlorate exposure. Bisphenol A, BPA in plasticizers, the plastics in many of the containers that we drank from for years until now they've reduced that. Fluorine, fluoride, too much fluoride. Mercury. Mercury amalgams, off-gassing of mercury. I mean, the list can go on, but I mean, I made a list here last night. Low iodine status, perchlorate, high exposure to fluoride, lithium. Many folks are on lithium. Which camera am I on here? You all right? I'm over here now. Okay. Excuse me. Fluorine, lithium. Many folks are on lithium. Excuse me. As mood stabilizers for bipolar disorders. Mercury, bisphenol A, bromine, as I taught, and Teflon. You realize that even Teflon, with Teflon-coated pans, can affect your thyroid. So let's just go back. I can have chemicals. I can have chemical exposures that are diminishing my body's ability to make thyroid hormone. So over time, I become less efficient. Number two, I could be taking oral hormones, HRT. That can be in the form of birth control pills. That can be in the form of menopausal. I could be using things like oral estrogen, oral Premarin, and so on. It increases the binding globulins that literally kind of engage the thyroid hormone and it interferes with utilization and makeup and how I actually even convert. So birth control pills, menopausal hormone replacement. Why do you think we like only typically topical forms of HRT? Why we do bioidentical hormones using the topical forms? Or in some cases, sublingual. We do not like the oral form because it goes through the liver, first pass metabolism, stresses the gallbladder, stresses your liver, and can interfere with this component. Let me go to now, real quick, I'm going to start mixing this, but then the conversion. There's more things that interfere with manufacture. But conversion. Now, conversion has to take place T4 to T3. Stress, high levels of stress. So high cortisol can affect this. It downregulates this conversion. I could be exposed chemicals, and why I'm jumping over to conversion, and I'll explain that in a minute, I could be being exposed to a lot of chemicals that are interfering with my conversion. This is what your thyroid gland makes, T4. It is called tetraiodothyronine. We need to convert to the active. This is anywhere from 4 to 8 times as potent as T4. So this is what the thyroid's looking to make. This is what you use in the way of levothyroxine, tetraiodothyronine, Synthroid, the brand name. The body wants to convert it to this in the cells, in the periphery, and in the liver. Why? Because I always term this the money ball. This is the active thyroid hormone. And if this is not happening effectively due to high stress, chemicals, or a bizarre diet, many of you have had a long history of a very bizarre diet. You didn't eat well. You had poor history from a diet. You did a lot of extreme things from a dietary standpoint. That's a huge, huge, huge problem. So, how do I make it? Am I making it efficiently? That becomes a problem. Chemicals, environmental chemicals, low iodine, because of the, I believe, iodine phobias that we have, other halogens that interfere with manufacture. Number 2, let's just talk about food allergies. Big problem. A few weeks back, we did a little teaching on leaky gut and how leaky gut can open up the door to immune reactions and autoimmune reactions. So a lot of times, folks with poor thyroid function have very, very poor gastrointestinal health. So he's saying like, well, wow, like we're all over the board here. No, we're not. We have to make it in your thyroid. I can have things that interfere with that. That could be a problem. Chemicals, etc. Maybe my pituitary is not signaling well. And I'm going to come back to reverse T3, and I'm going to talk about the thyroid hormones after the break. So I could not be making it well. I could be making it. Maybe I'm making it well, but then I am not converting to what? T3, the active thyroid hormone. I could be under a lot of stress. I could not have enough iodine and selenium here. Selenium helps the conversion. Huge, huge components here. Food allergies, leaky gut, and we will cover a little bit about antibodies and how antibodies play in, but I hope you're getting a little bit of the message here. We also know that obesity and weight issues, pregnancy, many times is a trigger for folks to go into low or subclinical thyroid function. So obesity, folks that have high levels of adipose or fat tissue are converting a lot of their hormones to estrogen. Estrogen dominance, so if you're overweight, that can be playing a role. Estrogen dominance can play a role here as well. We're going to go to a break. I wanted to cover some of these things, and I know I told Josiah yesterday that when we break these up into 2 shows, I believe that we lose some of the momentum and the clarity of what we're trying to do. I'm trying to go through this at warp speed in an issue that's very complicated, that is more complicated literally as we go along because of the interferences, environmental and otherwise. So what I'm going to try to do when we come back from the break is then I'm gonna show you a little bit more about T4, how it converts to T3, how it can go to reverse T3, what some of the labs look like, how you can define what makes sense, why you should have free T3s and free T4. So I'm going to try, if I can, to do this all in this segment. So we're going to go to a break. You stay with us. We'll be back in just a couple of minutes. Stay there. Love! I hope you enjoyed that. I love that. That was an upbeat, contemporary worship. Why do we do that? For many of you that are viewing, you get this completely. Worshiping God. Worshiping Him for who He is. Psalm 34 says, I will extol the Lord at all times. His praise will always be on my lips. I will glory in the Lord, and let the afflicted hear and rejoice. Glorify the Lord with me. Let us exalt His name together. I sought the Lord. He answered me. He delivered me from all my fears. He delivered me from all my fears. Talked a lot about fear and anxiety, lack of hope this past week on the radio show. And I believe many of us lack hope, unfortunately. And in part, I'm not saying it's our fault when we lack hope. Please don't misunderstand me. But I believe when we lack hope, that the only way that we can gain hope is by bearing down on what you just saw. A praise and worship. Praise enters, ushers in rather the presence of God in our lives. It does. It's something that we do. It honors Him. And when we do it, I believe God doesn't honor us for who we are. We are His creation. But as we praise and are willing to worship Him, He not only inhabits the praises of His people, but I believe He is ready and willing and able to help you in your time and position and whatever need that is. Back to thyroid. Just put up a couple things here that we're going to go back and just talk about the labs, right? So you've been going to the doctor, and they do maybe a TSH level in most cases, and sometimes they'll do a T4 level. And first of all, they're total T4s, and that's usually bad. So, you know, the typical range, whatever, 0.5. It used to be up to 6. Then they brought it down to like 5.5, and now some labs will even use 5.0 or 4.5. So if you fall into this range, you're normal. So they consider you normal. So your TSH could be 1.0 or it could be 4.0, and you're considering, and most medical doctors say, well, I want to treat you. And then this is where this article or whatever on Medscape came from the UK that said, it's almost negligence. What about my skin? What about my puffiness? What about my thinning eyebrows? My hair is falling out. I got all these physical symptoms, and you're telling me I'm normal. Here's where I think part of the problem is. Part of the problem is most physicians, in many cases, do not do thyroid antibodies. And it's thyroid peroxidase antibodies. This is too much writing. Antithyroglobulin antibodies, to name a few. And it's an indicator for Hashimoto's. Then there's some other indicators for Graves'. They're autoimmune. Graves' disease, autoimmune disorders can be caused by leaky gut, gluten and wheat intolerances, heavy metals, mercury exposures. We begin to develop an antibody production against the thyroid. So whatever the thyroid is making, it's being negated. Antithyroid peroxidase antibodies. It is negating thyroid hormone production. But let me try to simplify this. This is what your thyroid is trying to make, T4. Tetraiodo. Well, how's it make it? Well, it needs tyrosine. It needs iodine. In principle, those are the two key players for manufacture of thyroid hormones. Now, what's the body try to do? It wants to convert it to T3. Remember, the money ball. This is money right here, T3. This is where the potency of thyroid hormone comes from. And we always want to evaluate the free version. That's why I wrote free T3, free T4. And then what you have to evaluate is something called reverse T3. Because this is how the body's put into neutral. This to me is always, and the analogy is, my car is running, I've started my car, but I hit the accelerator, it doesn't go anywhere. I forgot that I put it in neutral. I don't have it in gear. Therefore, the car is running, it looks like it's okay, I'm accelerating and I'm going nowhere. Neutral. This is neutral. Why would my body go into neutral? Well, starvation, your body's trying to conserve energy. It drops the metabolic rate. This is why starvation diets are bad for your thyroid. Many people that have yo-yo dieting, 1 meal a day, skip meals all day, starvation diets, extremes, very low protein, low carbohydrate. These are all dangerous. Why? Because they can put you into reverse T3, neutral. And many times, for many of us, we get stuck in this reverse T3. So here's what happens. Reverse T3 and so on, your thyroid labs, your thyroid's saying, hey, my TSH is okay. I don't need to make more. I'm making all these adequate components. But much of it is being shunted over to the reverse T3, which is neutral thyroid hormone. Hence, my labs look okay on paper, but I have symptoms. I feel tired, I'm fatigued, I'm lethargic, etc. So, when we recommend thyroid tests, we want free T3s, free T4s, reverse T3, the thyroid antibodies, etc. Let me just, I tried to draw a little picture of if we could make an analogy of what has to happen. Let's just say they do a free T4 on you and they don't do a free T3 on your labs. Here's what happens. Let's just say, pretend this is the range. And this is your value right here. Nice high T4. Doc says, hey, TSH is good. Your T4 is good. Look, you're way up in the range. There's nothing wrong with you. And you've got all these physical symptoms of low thyroid function. I would enter in and say, hey, have you done a reverse T3? How much is she shunting away or he from T4? And what about a free T3? Ah, we don't need that. That's what they'll tell you. We don't need those. They're of no value because I've got a T4 and I got a TSH and you're good. Well, remember, they literally brought a suit against physicians in the UK 7 years ago calling it negligent, and it never got passed by Parliament, however that works with their socialized medicine. But they mobilized literally an army of lay patients saying, this is ludicrous, something's wrong. Now here's the key. When you measure this T3, literally there should be an equal amount or an equal molar. If I have plenty of this on board, I should convert it. Many people are doing this. You see what I'm after here? You have plenty of raw material. You're not converting it now because I lack copper, I lack zinc, I lack selenomethionine, I lack vitamin A, I lack vitamin E, even iodine. So now when I'm trying to go from this free T4 over to free T3, why this? Moneyball, right? Up to 8 times as potent. This is really what controls how you feel ultimately. So if I have plenty of this, see, this is supposed to be the range. So if I have, I'm in the 80th percentile, I should be converting to T3 in the 70, 80 percentile, meaning that I should have plenty of thyroid hormone. Many of you are not. So it looks good on paper, but the reality is you're very deficient in T3, plus you might be shunting over to reverse T3, hence I have tons of symptoms, hence why we have so many people that are disenchanted with the medical community, with endocrinologists, because they feel so bad and they're told there is nothing wrong with them. So what do we want to do? I would say to you, we want to make sure that you're eating a healthful diet. You need to be on adequate proteins. You need to be on good essential fatty acids, and we need to make sure we have you on adequate nutrients and minerals to make sure that you convert. So understand that stress plays, chemicals, why many times folks with problems with their thyroid, we will do an elimination diet. We'll put them on, actually even do a little bit of a GI repair. Go back and watch the leaky gut video because it'll teach you some things about this. We will put them on some massive doses of probiotics. You say, what in the world? Tell me I need to get some time-release T3 or desiccated thyroid. Well, that could be, and that may be in the cards for you. But I will tell you, even if you just jump over and do that, if you're not managing your stress, because the high cortisol, what's high cortisol doing? It is down-regulating this conversion of T4 to T3. So here's the problem. If I am making enough thyroid hormone, raw material, and then I'm under tremendous levels of stress and I got high cortisol and it's down regulating this production, you see it creates a smoke screen. Labs on the surface look okay, but your symptoms are major. This is why we've always got to have the free T3s and reverse T3s and so on. Elimination diets, I many times do a GI repair, and then we look at probiotics, right? Why? Because of gastrointestinal health and the link. All right? Many of you are battling autoimmune conditions, thyroid peroxidase antibodies, you have Hashimoto's, and many times folks, once they go through a Hashimoto's, initially there's a hyper mode of your thyroid functioning. You're in a hyper state. I'm agitated, racy, my heart is racing. They told me I have to be careful because I could go into thyroid crisis, and that's true. So they put me on a beta blocker, and they put me on an anti-thyroid medication like Tapazole or Methimazole or propylthiouracil. And then they told me that they just want to give me a radioactive iodine and just kill my thyroid. I think you try to do everything you can to protect it and keep it. I don't want to get between you and your physician, but I'm not always sure because for years they claim, well, we just give you a little wee bit of this radioactive iodine, and it really just goes and kills the portion of the thyroid that's really hyperactive and having problems. That's kind of pie in the sky. I don't even know if that ever happens. I will say it happens 1 or 2 in 100 times. Typically, when they give you this little bit of this radioactive isotope, it pretty much obliterates. Well, that's twice. Sorry. It pretty much obliterates your thyroid functioning. So, hyperthyroid autoimmune is what typically happens initially, but over the course of time, with damage and destruction, folks become hypo, and then they need they're on either Synthroid or desiccated thyroid, which is an animal-based that contains T4 and T3. See, Synthroid or levothyroxine or tetraiodothyronine, tetra meaning 4, tri meaning 3. Many times folks are put on that. But they're put on Synthroid, levothyroxine, tetraiodothyronine, but in many cases they feel, not all, please don't misunderstand me, not everybody that is on T4 experiences this. They don't feel well. Hence, then I say, why don't you give them a combination of T4, T3? Nature-Throid, Armour Thyroid, Thyrolar. Give them a combination of this because in many cases, why? Because they need some T3. Physicians say, no, we don't want to do that. We don't want to do that because that's too hard to manage. Labs are too hard to follow. Folks are all over the board. It's not consistent because it's natural sourced. We want a chemical because everything's consistent. But, consistency at the sake of efficacy basically is what happens. So they can control labs more efficiently, but they get consistency. It's easy to control, but they lack efficacy. Does that make sense? Benefits are often not there. I don't know what that percentage is. I'd say as many as 30 to 40% of the population that are on levothyroxines don't see major improvements in their low thyroid functioning, even though their labs get better, it's a check, but their symptoms continue to decline and remain. Hence, desiccated thyroids, or what we like to do is to do a mixture of T4, T3, and time release it. We make this up in the lab. Why? Because we don't need this time release, but you put them together because T3 has a shorter window of opportunity. We call them half-lives to work in your body. So as a shorter half-life, we want to extend the life of T3, and so many times this is a better option. Now that's kind of from a pharmaceutical and from a chemical intervention standpoint. Let's go back as we close this. Remember, I'm going at warp speed, so I'm talking fast and loud. Am I talking loud, Josiah?
No, but you're not writing clear.
Okay, I'm not writing clear. See, Josiah, he's honest with me, knows. And you know why I'm not writing clear? Because first of all, I don't write very clear and well to begin with, but I'm trying to write fast because I'm trying to do this in warp speed. But, okay, what nutrients? So here's what I'm going to tell you.
You got questions too, don't forget.
I got questions. Am I here? I'm over there. Okay, I'm going to go here.
You're moving and shaking, baby.
I'm moving and shaking and baking. So here's what I want to do with you. I want to get you guys on the right path. So the first thing I'm going to tell you, if you've got symptoms of this, if you've got weight issues, we need to lose weight. If you're under a lot of stress, I got to get you on some adrenal essentials, get you exercise. You know that even exercise is one of the, what shall I say, one of the tenets of improving thyroid function. Because as you exercise, you realize it stimulates thyroid production and conversion. God built you to move. And there are so many aspects of life that your exercise is stimulatory to how your body works. It'll work more efficiently. But if I don't have adequate nutrients, I can't make thyroid hormone well, and I can't convert. So the first thing is, if I'm overweight, I got to get you to lose some weight. If I'm sedentary, I've got to get you moving. If you don't take supplementation, I've got to get you on some basic antioxidant supplements, get you on some buffered C, get you on, maybe in this case, polyresveratrol or our trans resveratrol or resveratrol plus. Get you on some Perfect E, change your diet, get you on an elimination diet. You say, what in the world does that have to do with my thyroid? Everything. There's not something magical about your thyroid, but yet all your other organs function according to what you consume and how well you take care of yourself. But your thyroid is this diseased entity out here that functions all by itself. It does not. It's highly dependent upon the same principles and characteristics. So now let's focus on, because we want to get to some of these calls without boring you too. We're already, you know what I mean, emails. So here's what we need. We need to make sure, first of all, I need iodine. You need iodine. You need iodine. I don't care what anybody says. We're phobic in this area. We do iodine spot tests, urinary iodine levels to make sure to see what your levels are. Huge levels of misinformation. Now, I don't believe you need gobs and, hundreds of milligrams a day. I don't believe that's necessary. But I'll put folks on iodoral, 6.5, 12.5 milligram, 3-4 times a week. I don't believe you need to load up, but I believe that iodine is grossly underutilized, and it is very much interfered with, remember, by those halogens, chlorine, fluorine, bromine, perchlorates, and there was something else that I'm drawing a blank. It's not that important. Just know that there are interferences. I also need, without question, not only I need iodine, but I need basic amino acids. Many of you do not eat enough protein. I need tyrosine. If I don't have adequate tyrosine, this is an amino acid that is critical for that tetraiodothyronine to be made, T4. So I got to be able to make it. I got to have adequate material to make it. All right? Now, once I make it, nutrients are involved. I don't want to oversimplify this, but T4 manufacture is not just about iodine and tyrosine, but those are the key players. If I do not have those two in place, the other micronutrients, I've got a huge problem. Now I've got to convert this T4 to T3. Now what interferes, right? High cortisol, high stress, oral estrogens, chemicals in the environment. So a lot of things affect this conversion, but let's go to the basics. I need to have adequate vitamin A. I absolutely need to have vitamin E, and I'm not just going to use this. This has got to be like the mixed tocopherol, tocotrienol is like a perfect E. I need to have plenty of C on board, and then we start getting in, and there's some other things. But zinc, do you realize that just zinc deficiency alone could be one of the reasons for your low thyroid functioning? Right there. That one mineral. Huge player. Low selenium status, selenomethionine. It's the one that's found in foods. It is the organically bound. If I'm deficient in selenium, I don't convert to T3. So vitamin A, vitamin E, C. You say, well, I eat well, good, praise God, but sometimes we need to have additional nutrients. Do you realize that copper, I think it's 2+, copper is critical to conversion of T4 to T3. Copper. So let me just give you an example. Thyroid support. Vitamin A, some C, you should be taking your buffered ascorbates, a little bit of D, B6, you realize that B6, B3, B1 are critical as well. Iodine from kelp, a little bit of magnesium, zinc, selenomethionine, copper. All right, we covered all the bases. Tyrosine at 500 milligrams, wherever I had tyrosine, I took it off. And then a little bit of some herbs, gugulibid and ashwagandha, bacopan, that all are a kind of adrenal and thyroid supporting types of herbs. All good, but you've got to have adequate mineralization. The Bs, if you don't have zinc and copper, you have huge problems. You can never convert. If I don't have tyrosine and iodine, I can't make. Then I got to convert. Say, this is way too complicated. No, it's not. It's very simple. I think it's very simple. Before we do anything, I could get you on some iodoral, get you on maybe minimum 2 a day of thyroid support, maybe get you on more like maybe 3 to 4 eventually, maybe a half of an iodoral of the 12.5 milligrams 3 to 4 times a week, get that iodine in there, get more tyrosine. I might even eventually recommend a pure like protein smoothie once a day. Change your diet, start you exercising to stimulate thyroid production, and then I make more, I convert more, and then we got to watch of the interferences of chemical. And so many times it's important that we even think about doing detox protocols. I made a note, as I made some notes last night, animal studies show that higher antioxidant status, even in animals, if you load them up with antioxidants, vitamin A and C and E, their thyroid function improves. Literally, just by loading them up with antioxidants in animals, their thyroid function improves. I just wanted to look through to see, just in case I missed something. I'm hoping this answered some of your questions today. I feel like there's some things that I know I did not cover, and I feel a little bad about it because I feel like I've tried to do this a good service, but I think I've done it a little bit of a disservice because there's more to this. But again, to try to do it in one setting, pretty difficult. But I feel it's imperative that I keep them in one settings to make sure we keep clarity. Now, if we have not some calls, but some emails, because I'm not doing the radio here, I'm doing a live stream. So let's see, what do we got? We have some questions here maybe that I can handle?
Yeah, hold on. Okay.
If you want to just read them to me, that'll work.
Bioidentical HRT by way of implanted pellets.
Okay.
How would that affect my thyroid compared to oral or topical HRT?
If she's doing implanted, question is, I'm doing pellets. I'm doing HRT that are in a pellet form. You're okay. It shouldn't downregulate your thyroid hormone synthesis.
Next question is from Michelle. She wants to know, is your thyroid support vitamin appropriate for hypothyroidism?
Vitamin appropriate. Good question. I would say yes, because thyroid support, we just went through some of the key nutrients, right, that are important. Why we need vitamin A, why we need zinc, why we need selenomethionine. So, yes, I would say that it is, without question.
Next question. I wear a sweater all day long, even in the summer, yet I wake up at 3 a.m. from night sweats. Could this be thyroid related?
If you wake up in the middle of the night with night sweats, again, outside maybe my area of expertise, but I've not really ever seen thyroid issues. Am I up front here? I've not really seen thyroid preps or thyroid functioning be related to night sweats. Is it possible that that poor gal has a couple of things going on, that she's got possibly some thyroid issues because of she wears a sweater all day, but also she could have some female hormone imbalances that are manifesting more at night, or is it? I don't know. I don't even know what her dream and REM sleep is like. There might be a ton of stress, and why she's waking up possibly distressed with a lot of heat production. Is that it on those? All right. Hey, I hope that you have been blessed. I hope you learned something today. Hypothyroidism, low thyroid. If you have some comments, you want us to do more on this, you want us to get more detailed, I certainly will. Send us an email. Maybe you have questions about, maybe we can do a little segment on autoimmune thyroid and some other factors, just as a quick snippet. Today, I wanted to do hypothyroidism, low thyroid functioning, misconceptions. I hope we did it justice. I'm a little concerned I didn't. I pray the message gets across. God bless you. Thanks for being with us. Make sure you take a look at the other live streams. Tell some of your friends and neighbors. Share the knowledge and the information with them. Blessings. Have a favored and blessed day.